Today I'm going to be performing a central line dressing change while flushing out the central line, and then later on I'm going to be removing it. But as of right now, I'm going to review the patient's chart, look over the order, put a sterile procedure sign outside of the room, and then I'll knock on the door, perform hand hygiene. And as I enter, I'm just going to say, "Hi, my name is Julia. I'm going to be the nurse taking care of you today." All we're going to be doing is changing that old dressing, flushing out the central line, and then putting a new dressing on for you. So before I begin, I want to identify the patient using their ID badge. I'll look for their name, their date of birth, have them repeat it to me, and then I want to adjust the bed up to a proper working height, close the curtain for privacy, and make sure I have my table all wiped down as well in order to begin doing everything. So the first thing I want to do is perform hand hygiene one more time, and then I will also put on a mask for the patient. If the patient can't wear a mask, I'll have them face towards the opposite direction of their central line, and then I want to make sure I have my mask on as well. So since I just did my hand hygiene, I can put on my clean gloves. And the first thing I'm going to be doing is removing that old dressing. I'm going to be using the push-pull method and using an alcohol wipe to help deteriorate that glue. So we want to try not to hurt the patient. So I'll take my alcohol wipe. And then I'm going to be careful around the central line as well. If I have to, I can hold it in place. And like I said, I gotta be careful around the central line, making sure I don't pull it out. I can take off the old pad as well. And then while I have everything off, I'm just going to assess the insertion site. I want to palpate to check for any inflammation, redness, tenderness, make sure that the patient's feeling okay. After I've assessed everything, I can begin cleaning around the insertion site. So I will take off my clean gloves, perform hand hygiene, and then I can begin setting up my sterile field. So I will take my pad using the 1-inch border. I didn't see those. Make sure this is set on top. And then I can don my sterile gloves. Apply that hand hygiene one more time.
Ready, set, go.
Hi Bob, I'm Caroline from the University. I see that you have an order for a body due to infiltration. So can you verify your name and date of birth for me? This is perfect, thank you. So first thing we're going to do is
All right, once I have my sterile gloves on, I want to make sure they stay above my waist. And I can begin cleaning around the insertion site. So the first thing that I'll grab is my alcohol swab stick. And this is just gonna help clean off dry blood, any secretions or any dirt right around that insertion site. All right. Once that is all clean, I'll let it dry. Usually takes about 30 seconds, but you want to double check and make sure that you visibly see that it is dry. And then I can take my chlorhexidine. I'll activate it by snapping it. And then I want to clean everywhere where my new dressing is going to be applied. And I can clean the tubing of the central line as well. So I'll just make sure I snap it. And I want to use moderate pressure.
then I'm going to apply pressure.
Cleaning down here, both sides.
Then I'm gonna perform hand hygiene and get started with cleaning.
And with both the Q-tip and the chlorhexidine, I'll clean from the inside to the outside as well. So after I am done with that, I'll let that dry. And then once that is dry, I can apply my new pad
And actually first,
or my bio patch. So with my
wash it.
new bio patch,
Next wash, next take this.
I'm going to be breaking the sterile field with this hand. So this hand will no longer be sterile since I'm touching that central line.
I'm gonna do my two.
And then
So
I will
perform hand hygiene. I'm gonna look at my bag.
apply that new patch.
Looks good. It's not expired.
All right,
Just wipe it off.
that looks good. And then with my sterile hand, I can get my Tegaderm out.
On both the tubing as well as the bag. And everything into the bag.
But before I put on my Tegaderm,
Take my
I also want to
tubing
use
and run it.
my skin protectant barrier. And I will also clean all around where that Tegaderm is going to be applied.
Take my cap off the bag.
Make sure that is dry as well.
So I take my cap
And now I can do the Tegaderm.
push, push, it's smooth with it. And then I'm gonna
And then when applying this, I want to make sure that it's occlusive, it's covering the insertion site.
so that I can prime it, and I'm gonna be watching for any air bubbles. And if there is any air bubbles, and so immediately after I have my cap back on. So when I put some gloves on, ready to insert that cap.
All right, and then I'll take my sticker, put the date, time, and initials on it. And I want to make sure that I'm placing this on the side of the Tegaderm, not near the insertion site, because we want to have clear visibility of everything. All right, and once that's on, I can go ahead and take off of my sterile gloves. And then I will perform hand hygiene. and I can put on my clean gloves in order to flush out the central line.
And then after I or I'm gonna insert this double up 10 to 15 minutes apply the safety needle and then connect my safety tubing.
All right, once I finally have my gloves on, I'm going to take my solution, actually I want to get this out first, only exposing the tip where I'm going to be putting my syringe on. And I can take this, and I want to prime it, and then put a little bit on there as well, and I can put that on, and then I'll make sure I prime the other end. That is all good, and I'll set that to the side for now. All right, and then I want to clamp my central line, take off the old cap, use my site scrub, clean off the insertion side. Doing this for about 30 seconds. All right. And then I can take my syringe out of its packet.
Priming it, taking all of this off. Like you don't have to remove this, it's just remove this.
And then I'll prime this as well.
Holding this when you grab clean.
Looks like we have a cap on here, so I can take that off. But since I haven't touched the actual insertion point, I am all good. Just make sure, get a couple drops in there, and I can screw that on. All right. And then when I'm doing this, I want to make sure this is unclamped. I'm going to be using the push pause method and inserting the ordered amount. And then I will pull back a little bit, make sure I have good blood flow, and then insert the rest using the push pause.
So then I would make sure my clamp is open. And I also would have taken my tourniquet off.
All right. Once that is all in, I can take this off, get my heparin ready, take this cap off, prime it,
Prime it again, and set this off to the side. And then you can take this off,
and then put this on.
in your hand, grab this, and then connect it.
And then same with the heparin, I'll be using the push pause method and inserting the ordered amount.
I would say push pause.
I didn't even realize the that's not, you might get a half a point or a point.
And then use the heparin.
You don't even know if you failed it yet.
So before you take this off,
Also, in between changing syringes, I should have clamped this as well.
this on, unclamp it, 5 cc.
All right, once the heparin is all ready, I will clamp again,
I wanna film my video first.
take this off,
I wanna get it done.
and then put my new sterile cap on.
I'm gonna look over here.
Once that is done, I will unclamp it, and then clean up my station, give the patient their call light, put the bed back down to where its original position was, ask them if they need anything, and then I am all good to head out. So since that is done, I have a new patient. I need to be removing the dressing and taking out the central line completely. So I will review the order for that, review the patient chart, walk in, same thing, look at their ID badge, scan it, let them know that we are all good to be taking their central line out. When I'm taking their central line out, the first thing I want to do is remove the dressing. So I'll be using the push-pull method again, making sure that I'm careful around the line. And then once I have that out, I will instruct the patient that they're going to be laying down. I want them to exhale, hold their breath, and then I will slowly pull the central line out. Once the line is out, I want to assess to make sure that the measurements are correct, that nothing is inside the body still. When I'm taking it out, I also want to apply pressure with gauze. Hold that for about a minute or two or until it stops bleeding. Put on some tape, and then I will assess the patient for about 30 more minutes until they are able to leave the facility. And that is it.